Welcome back to CEO Money. I'm Ed Baxter, sitting in for Michael Yorber, and right now we're joined by Sebastian Seiguer, founder and CEO of Emocha Medical Health. Hope I said that right, Sebastian. I'd like to start, if it's okay with you, about this giant brain you seem to have with these degrees from some of the best schools in the country, Columbia and Johns Hopkins, and that's pretty impressive. And how do you go from there to being this level of entrepreneur?
Right. It was a lot harder to get into those places a while ago than it is now. I mean, it was a lot easier than now. But, I practiced law for about 1 year in the UK, straight out of law school. And I saw an opportunity while I was visiting a client in Germany. I saw an opportunity and I took it. From there, the path's been a long way coming. So, from Europe, after selling my company in 2010, I moved to Baltimore and got into the field of medical technology.
Fabulous. And I guess that leads us to your most recent venture here. Tell us a little bit about, is it Emocha? Am I saying that correctly?
Yes, it's Emocha Mobile Health. We are using video technology to make sure and support patients in taking every dose of their medication. So we have a smartphone application which patients use to video record themselves at every single dose, and providers or their proxies, third parties, can review that information and check whether the patient actually took their medicine.
Wow, that's pretty impressive. Let's kind of drilled into that a little bit deeper. Why is it important to have that level of, confirmation when it comes to taking the proper dosage?
Sure. Well, it sounds really basic, but fact of the matter is that about 50% of medication is taken properly. And it's common sense, but medication doesn't work if you don't take it. And in some cases, it not only does it not work, but if you don't take it properly, the consequences are pretty severe. They can be death as well in some cases. So we've started off in those areas where the ramifications are they can be so tragic that you have to make sure patients take it. So we're talking about tuberculosis, hepatitis C, and now opioid addiction, which, the medical terminology is opioid use disorder.
One thing that stands out is the president just recently dealt with that very issue and with opioid use and misusing those drugs. Why is it important that the United States as a country adopt, emerging technologies for the purpose of dealing with this issue?
Right. Well, our rate of addiction is staggering, and it's probably unprecedented. So, and I think that there is a lot of attention being paid to opioid addiction, but I'm not sure that the scope of the problem has been understood. The death rate is tremendous, and it has to be changed. Action has to be taken now. The fact of the matter is, though, we have a really big country, right? We have some 400 million people spread across a vast geographic area. And people who have opioid addiction are not confined to urban centers. They're all over the place, and not all of them can access treatments. And treatments have to be, first of all, treatments are not available to all of them, so only 1 in 10 people with substance use disorder are accessing care. So a huge effort has to be made to get them these treatments that can really help prevent overdose deaths.
Perfect. We have a couple of minutes left here. Now, I'll leave you with a couple of questions I'll give you a chance to answer. One, how does your technology improve the doctor-patient relation and lead to better medication? In addition to that, how can we stop the epidemic, or how can you stop it with your technology?
Sure. So on the first question, people taking their medication adherence in general is driven by the provider and patient relationship. It doesn't matter what the case is. People just have trouble taking their medication. And it has been proven that direct observation improves medication adherence, and that's the only technique that's ever been proven to move the needle on medication adherence. And part of that direct observation involves the patient-provider relationship and strengthening that. And we've seen that across all the sites, including sites near you in Collin County, Texas, or Harris County, that are using Emocha successfully. In terms of ending the opioid addiction problem, there are probably two major efforts underway. One is making sure that treatments for pain, that those prescriptions are reduced. We can't really help a lot with that. But people who are already addicted, Getting access to medication-assisted treatment, that's where Emocha can help in partnership with great clinics who can offer these take-home medications. Some are in your area, for example, Dallas-based Pathway Healthcare.
Perfect. That's great. I'm sorry we have to wrap it up here. If people want to get more information about Emocha, where would they go?
You can go to www.emocha.com or follow us on Twitter at Emocha Health.
Sebastian, thank you very much for joining us. I feel in awe of just your education by itself. Thank you for being with us. Thank you very much. Thank you for joining the CEO Money Show. This is Ed Baxter sitting for Michael Yorber. This last section was sponsored by our title sponsor, Tycon Partners. We'll have more great information and things for you tomorrow.